Dr. Chase had lots of expressions that he used often, and we all loved him for it. And one was this expression: listen to the patient. The patient's trying to tell you what the right thing to do is.
I didn't think he had any idea who I was, because I'd only been on the service for 3 days. And when I got down to him, he said, "Listen, I need your help." And I said, "Why me?" And he said, "Because you're terrific. I've been watching you very carefully for these 3 days you've been on the service, and you're far and away our best student. You've got to go over there and do this." Well, I thought, I'm the best student. Sure, I'm going to go. And by the time the 2 weeks were over, nothing would do but that I would be a surgeon.
I think his openness of accepting orthopedists, general surgeons, plastic surgeons, you name it, into the program and integrating that. Cross-fertilization of ideas. He was one of the leaders in that field. That didn't exist before then.
We have a boy who is now 9 years old in Mexico. If we brought him to the States, could you operate on him? I said, "Oh, of course we could." And fortunately, he got a very nice result and went back essentially fully rehabilitated. That was only the beginning, because the Latin American Mission Project said, "Hey, we've got a number of children in Mexico that need the kind of help that you can give them." Don Laub was then my chief resident in plastic surgery, and I asked him to come with me to Mexico. Well, he came down, and I must say, he caught fire when he saw this and said, "Oh my gosh, what an incredible opportunity." And it was Don who then really formed the organization that became Interplast.
And Dr. Chase drew out the plan for the surgery on the hand, but after that point, it was hard for me to tell who was doing the surgery.
Made you feel like you were the surgeon and calling the shots? You know, I'd have these horrible Dupuytren's contractures. I'd done a few in my fellowship, but at the VA there was lots of them, and they were really complex, with the spiral cord and contracted finger. And Dr. Chase was there, and he'd say things like, "Oh, you don't need me. Oh, I'm in the way."
He loved to guide the young students and medical students and health officers through procedures. And you knew that when you worked with Dr. Chase, the surgery would go well. And he was the greatest surgical assistant. We used to say that Dr. Chase, unbeknownst to you doing the surgery, was actually doing the case with a little dull probe in his hand.
In a sense, that's what the secret is to make the person doing the surgery, who is the resident, let's say, think he or she is doing the operation, when in fact it is quite dependent upon you being there and making sure that they do the right thing. And I would have to say, because of my relationship with Bill Littler, that thumb reconstruction probably is at the top of the list. First of all, the whole idea of transferring, for example, an index digit or any digit to the thumb position, particularly before the days of microsurgery, where it could be a free transfer like a toe or something else, transferring a part meant a careful dissection of all of the nerves and blood vessels that supply the digit being transferred, and being careful to make best use of those parts that still remain in reconstructing a thumb, and adhering to the principles that Bill Littler himself has so beautifully outlined for thumb reconstruction. Well, one of my favorite patients was a baseball pitcher for the Atlanta Braves. He jumped up, hit the awning and caught his ring on the awning hardware and avulsed all of the soft tissues from the ring finger of his pitching hand. And we used a large island pedicle flap from the little finger onto the ring finger to give it sensibility and so on the palm aspect. Finally, got a fairly good result from having a very serious injury. Enough so that he went back to playing ball for the Braves. Well, I first got interested in hand surgery as a result of being in the Army at the time of the Korean War, and I was taken into the Army on active duty and became head of surgery at Fort Monmouth Hospital in New Jersey. I got a call from the Surgeon General's office inviting me to go to Valley Forge Army Hospital if I wanted to. Before World War II, the Army had no hand centers, and it was Bill Littler, together with Sterling Bennell, who made the decision that we ought to have hand centers in the services. That came about because injured soldiers coming back from Europe, for example, if they had multiple injuries in the upper limb, if there was a nerve injury, they'd go to neurosurgery. If there was a soft tissue loss, they'd go to plastic surgery. And if they had bone or joint problems, they'd go to orthopedic surgery. And it was Littler's contention when he was at Cushing General Hospital in Massachusetts during World War II. He said, look, we ought to establish a regional specialty, the upper limb. So at about age maybe 65 or so, I stopped doing surgery, except maybe to help residents once in a while, and went over and did anatomy for that period of time. Got terribly interested in it, and have been interested in it ever since. I would say that a knowledge of anatomy is perhaps the key, one of the key parts of being a good hand surgeon.
The Summit Group that he helped start eventually revolutionized how education was delivered within the medical school, beginning with 3D of anatomy, which was the first thing we did, then adding to it hypermedia, which was very new, then digitized video of lectures, and he was a doer. He could build things. He built things with his own hands. And being a doer, he wasn't scared of just stepping out and starting a new experiment and knowing how to carry it through.
Dr. Chase, by design, is an engineer, even though that was not his training, but intuitively he is. Dr. Littler was an engineer and an artist. You know, that they certainly understood the Da Vinci approach to the human body, and the legacy is to continue that concept.